After the age of 60, a woman's body goes through subtle yet significant transformations. These changes are rarely discussed, yet they can greatly affect health, well-being, and even a woman's outlook on life. The skin becomes thinner, hair changes its color and texture, and sleep is no longer as deep as before. However, there is one area that suffers silently, which many women prefer to ignore, not touch, and not even mention in conversation. This is the intimate area. After 60, the vagina and the entire pelvic region undergo deep and important changes. With age, natural lubrication decreases, which reduces protection against infections, disrupts the acid-base balance, and thins the vaginal walls. As a result, they become more sensitive and vulnerable to damage. All this significantly increases the risk of infections, irritation, pain, and even urinary incontinence. The saddest part is that almost no one speaks openly about this problem. Most women silently suffer from these symptoms, and many do not even realize that they have a name, a cause, and, most importantly, effective solutions. A study published in the Journal of the American Geriatric Society observed more than 2,000 women over 60 and showed that more than 70% reported unpleasant symptoms in the intimate area, yet only 15% sought help or received appropriate recommendations. So the problem exists, but the silence is even greater. And this silence gradually undermines the health of millions of women. Quietly, because of lack of information, fear, shame, or the belief that this is simply how things are supposed to be. But no, it is not supposed to be this way. And that is exactly why this video exists. Today, I will show you in 4 very important parts the main care measures every woman over 60 should know about for her intimate area. Naturally, respectfully, and clearly, without taboos and without shame, because your health can no longer wait. So, write how old you are and where you are watching from. That way, I will know how far this message has reached and who is with me in this mission to restore dignity, pleasure, and health to mature women in our country. Let's begin. Part 1. The truth about the vaginal lining after 60. As a woman's body ages, it goes through many changes, but few are as ignored as those affecting the vaginal lining. After menopause, the level of estrogen, the main hormone that protects this area, drops sharply. And what does this cause? The vaginal walls become thinner and more sensitive. Natural lubrication disappears or greatly diminishes. The pH becomes more acidic, disrupting the balance of protective bacteria. Blood circulation in this area decreases, making tissues more fragile, and the risk of pain, infections, bleeding, and burning increases significantly. This is called postmenopausal vaginal atrophy. But many women realize something is wrong only after years of silent suffering. Few know that there are natural ways to strengthen this lining. With regular care, it is possible to restore the vitality of the intimate area without synthetic hormones or expensive procedures. Here are 3 simple actions to protect the vaginal lining after 60. Natural oils. Using pure plant oils, such as unrefined cold-pressed coconut oil, can help restore local lubrication and protect against microorganisms. Blood circulation activation. Light walks, pelvic contractions, and even gentle touches in the area promote blood flow, which nourishes tissues and speeds up recovery. A diet rich in phytoestrogens. Flax seeds, fermented soy products, yams, and chickpeas contain natural compounds that help balance the effects of hormonal decline. A study published in the Brazilian Journal of Gynecology and Obstetrics showed that women who regularly use coconut oil in the intimate area reported significant improvement in lubrication and reduced discomfort in less than 30 days, without side effects. In other words, nature gives us resources, but it is you who must allow yourself to care for yourself. Part 2. What happens to vaginal pH after 60 and how to restore balance before infections, discharge, and burning appear. Did you know your intimate area has a natural pH, a specific acidity level that protects against fungi, bacteria, and inflammation? When you were younger, this pH was slightly acidic, and there was a flora rich in beneficial bacteria, lactobacilli, which created a true protective barrier against foreign organisms. But with menopause and declining estrogen levels, everything changes. The pH becomes disrupted, lactobacilli disappear, the lining becomes more vulnerable, and the natural defense is destroyed. The result: unusual discharge, constant itching, burning sensations, and infections that appear, disappear, and return again. Worst of all, these symptoms are often mistaken for poor hygiene, causing even more shame and silence. But now you know the truth. This is not lack of care, it is lack of information. Fortunately, there are natural ways to help restore pH and rebuild this protective barrier. Fermented foods, such as kefir, unsweetened natural yogurt, and sauerkraut help restore the vaginal microbiota from the inside, balancing pH and strengthening immunity in this area. Avoid regular soap. Most soaps have neutral or alkaline pH, which further irritates the lining. Choose gentle intimate soap with acidic pH. Sitz baths with apple cider vinegar. 1 tablespoon of organic apple cider vinegar in 1 liter of warm water for 10 minutes twice a week. This helps restore pH and soothe mild irritation. A study published in the journal Menopause showed that women over 60 who began using pH-restoring measures had a 63% reduction in urinary infections and recurrent candidiasis. In other words, when you care for the foundation, everything begins to improve. Part 3. The link between vaginal dryness, insomnia, and low libido, and what you can do to restore pleasure and well-being. Have you ever felt irritability, sleep disturbances, and no desire to do anything without knowing the reason? You might not have thought about it, but it could all begin with problems in the intimate sphere. Vaginal dryness is not just an unpleasant feeling. It is a signal that internal changes are happening in your body. Lack of lubrication is closely linked to a drop in estrogen, the hormone responsible for sleep, libido, mood, and even the production of serotonin, the so-called happiness hormone. When this important component of female nature fades, everything else begins to suffer. Sleep quality worsens. You wake up feeling tired. You feel detached from your body. And eventually even pleasure can become something unattainable or even painful. However, this does not mean all is hopeless. Scientific studies have already proven that there are natural methods to restore these functions without synthetic hormones or medications with unwanted side effects. Here is what can help. Omega-3 and vitamin E, found in seeds such as flax, sunflower, and sesame oil, help naturally moisturize inner tissues and balance hormones. Adaptogenic plants, such as maca and ashwagandha, strengthen the female hormonal system, increase energy levels, enhance desire, and improve sleep quality. To maintain moisture and comfort of the lining, you can use intimate care with natural oils, such as almond or rosehip oil. A study presented in the journal Complementary Therapies in Medicine found that women who used maca extract for 6 weeks showed positive changes in lubrication, increased libido, and deeper sleep. And most importantly, all this came without side effects, without dependence, and with a renewed sense of connection to their own bodies because pleasure has no expiration date. Intimate health is also part of your life force. Caring for it is an act of self-respect. Part 4. Hygiene and shower mistakes that harm intimate health in older women and how to avoid them with simple steps. It may seem strange, but many women harm their intimate area precisely during hygiene procedures. Yes, it is true. Due to lack of proper information, intimate hygiene is often done too aggressively, and over time this destroys the vagina's natural protection. Here are the most common mistakes. Using regular soap or antibacterial products. They kill beneficial bacteria and disrupt pH, making the lining even more vulnerable. Antibacterial soap can negatively affect the delicate skin of the intimate area, especially in women over 60, causing dryness and irritation. Vigorous washing, using washcloths, or rubbing can damage the sensitive thin skin of the vulva, which becomes even more fragile with age. Excessive cleansing or aggressive action can cause microcracks, redness, and even invisible inflammation. It is important to remember that internal douching is harmful because the vagina has an effective self-cleaning mechanism. Introducing water or fluids disrupts the vaginal protective barrier. Wet wipes, talc, or intimate scented products containing alcohol, fragrances, and chemicals irritate and disrupt the natural balance of the microflora, even if they seem gentle. Scientific recommendations for women over 60 are: use intimate soap with pH from 3.5 to 4.5, intended only for the external vulva area. Wash gently with your hands, avoiding washcloths and rubbing. Use a soft towel, touching the skin lightly. Do not rub it. Avoid any scented products in the intimate area, even if they are marketed specifically for women. Wear cotton underwear and sleep without underwear at least twice a week. This creates favorable conditions for the skin to breathe and reduces its moisture. A study published in Harvard Women's Health Watch found that older women who switched to gentler intimate care experienced a noticeable reduction in infections, irritations, and recurring discomfort. Thus, gentleness of care is the key to health. Caring for your intimate area is not an indulgence. It is a sign of respect for the most delicate part of your body. Part 5. Pelvic floor weakening. How to regain bladder control, restore the firmness of the intimate area, and bring back pleasurable sensations with simple exercises. Have you ever experienced involuntary urination during coughing, sneezing, or laughing? Or felt unusual pressure in the intimate area, as if something is dropping down? This is not a sign of weakness, but evidence of weakened pelvic floor muscles, which support the bladder, uterus, and intestines. The direct connection between pelvic floor muscle health and intimate pleasure, urinary control, and vaginal firmness is clear. However, after 60, muscle strength, elasticity, and tone in this area gradually decline. This is especially noticeable if a woman has given birth naturally, has not been physically active for a long time, suffers from constipation, or has never received recommendations to strengthen the pelvic floor. As a result, problems such as urinary incontinence, a feeling of weakness and looseness in the vaginal area, and decreased sexual pleasure may appear. In more severe cases, vaginal prolapse occurs when the bladder or uterus descends through the vagina. What is most absurd is that most women live their entire lives not knowing that this area can be strengthened with simple exercises. They're called Kegel exercises. These are light, controlled contractions that activate the pelvic floor muscles and help control urination, increase firmness of the intimate area, enhance pleasure, and prevent future surgery. To start right now, do the following. First, empty your bladder. Then take a comfortable position, sitting or lying down. As if you were holding back urination, contract the vaginal and anal muscles. Hold this contraction for 5 seconds, then relax for 5 seconds. Repeat this cycle 10 to 15 times twice a day. Within a few weeks, many women notice improved urinary control and increased sexual comfort. A study presented in the International Urogynecology Journal found that women over 60 who regularly did Kegel exercises for 12 weeks had a 74% decrease in mild and moderate urinary incontinence. The effectiveness and accessibility of this method make it a true breakthrough for improving intimate well-being. In conclusion, caring for your intimate health is not just a pleasant bonus. It is an important aspect of well-being, self-respect, and a full life. After 60, our bodies change, but this is no reason to accept pain, dryness, discomfort, or shame as inevitable. On the contrary, at this age you deserve maximum comfort, pleasure, and respect for your body, starting with yourself. If the information from this video has been helpful to you, share it with other women. It might be a true revelation for them because your sister, friend, or mother may never have dared to ask such questions. Let's openly and boldly share this information because aging does not mean falling silent. It means embracing with strength all the possibilities that still exist within us. Yes,